Hi, Dr. Emily here with Health Chiropractic. A common question that I get from parents when they're bringing their baby or their child in to get evaluated is how does my child's spine get shifted out of alignment? Okay, and that's a very, very good question. And so the two most common reasons are in utero constraint and then birth trauma. So let's talk about that in utero constraint first. So basically, that is how the baby's positioned inside mom. Okay, that's why we love seeing pregnant moms because we do our best at keeping that balance of the pelvis so there's the most amount of space for that baby to grow and develop, and ultimately we're looking for a good birth experience too, right? So thinking about that pelvis is kind of like a basketball hoop, and so we're trying to keep that basketball hoop nice and round, and so there's lots of space for a baby. What happens is sometimes there's a lot of different stresses happening to a mom's body, and that basketball hoop can shift, rotate. One side of the pelvis is higher than the other, and when that happens, that opening isn't as big as it could be for baby to grow and develop and get in that best position. So if baby's cramped in utero, that can cause stress to the spine. The second most common reason that we see subluxations, misalignments within a baby's spine is the actual birth process, okay? And even a wonderful, beautiful birth, it's still a big baby going through a small space, and that can be hard on baby and on mom, but it's even more so important to get your baby checked if there was any intervention, if the doctor had to physically pull on the baby to get the baby out of the birth canal, forceps, vacuum. C-section is a whole nother type of stress that is hard on a baby. Even a planned C-section, you think about it, it's different because with a vaginal birth, mom's body is helping to push the baby out, right? C-section, the uterus is almost acting more like a suction, so there's definitely stress on a baby's spine when having a C-section, and even more so when it's an emergency C-section. So we always encourage parents to get their babies checked on that proactive approach to health. We have parents who have brought their babies to see us before they got home from the hospital on their way home. So it's really an absolute joy to be able to check and evaluate and adjust babies, and I get so excited about it. So hope that clears up some common questions that we get.